Dr. Patel, let's talk about gum disease. There's so many names around that: gingivitis, periodontitis, whatever. I can't even pronounce it. Gum disease, periodontitis. Is it all the same? What is it? Give us the definitions of what is what, and what difficulties each one brings with it.
Well, gum disease basically starts by not brushing the teeth well. And once you do not brush the teeth well, within 30 days, the bacteria, which is with the plaque around the teeth, they colonizes. Once they colonizes, it becomes a bit harder for the patient to brush and take out those hard, what we call the tartar, the calculus. Once the calculus goes inside slightly below the gums, it is called gingivitis. And once it breaks the tissue where the gum is attached to the tooth and reaches slightly more inside towards the bone, it is called periodontitis. So between the gingivitis and periodontitis, gingivitis is very, very easily treatable. But once it goes into the periodontitis, it keeps going inside. The tartar or the calculus keeps extending inside between the bone and the tooth structure itself. And it could be ending up with a severe, with a moderate and a severe periodontitis. Once it reaches the severe periodontitis, that means around the tooth itself, the root itself, about 50 to 70% bone loss has taken place. And in that situation, we may have to pull it out. Before, we used to try as much as possible to save those teeth, but now the great alternative of implant has been replacing that modality of treatment, and patients are going more for implants in those situations. So the gum disease, again, can be replaced, it can be gingivitis or periodontitis, and it can be depending on how severe it is.
I see. So basically the different names are all the same thing, but slightly more severe as they progress.
Yes.
And periodontal disease, gum disease, basically the same thing. So at the last stage, at the beginning is gingivitis, and that's just kind of like, that's still easy to fix. Can that be fixed by the patient himself, or does he need to go to a dentist for that?
Well, his bad habit has already created the disease. So unless and until he changes and improves his habit, he is not going to treat it himself. Gingivitis is quite reversible by the patient by cleaning it nicely. If he can clean it the way we have taught, with the nice flossing and the nice brushing at the right areas, he may be able to reverse the gingivitis himself. But then it is best to have it cleaned by the professional hygienist or the dentist, and then do it himself. That would be the right recommended way.
And basically the gum disease is something where like kind of like the food and the blood starts going between the teeth and the gums, and it is in there, like a little bit like having chicken and spinach under the carpet, and it gets all rotten and stinky and eats away the flesh. Is that a little bit how it works, and then you guys need to scrape it out?
Yeah, in a layman's term, if that is the right way of explaining it, probably. It goes slightly below the gums, and then it sticks there. It harbors more bacteria. Once the bacteria is harbored by this sticky, gluey things between the gum and the tooth, what we call the plaque, and once the bacteria colonizes, it makes its own colonies and hardens up as it grows. And when it hardens up, it becomes calculus, when it's a bit difficult for the patients to clean. But before that, it would be easier for the patient to clean. Otherwise, it just progresses.
I got it. Now, let me ask you. I have read in a journal that in Japan there was a university who did research, and they said that, for instance, gum disease brings down the immune system so heavy that, for instance, if a person has the HIV virus, it can easily go into AIDS because the immune system is so low. At the same token, in California, there was a lady, she had a stillborn baby and they found the gum disease, that yellow, ugly, yellow, reddish, ugly pus, that gum disease, they found it in her placenta. Now, obviously, those are severe cases and they don't happen every day, but if they can happen, and I want to know from you whether that is actually really possible true, obviously it makes sense that a gum disease is affecting the immune disease of a person very heavy, and he could get the next flu or just basically get any and all illnesses much easier only because he has a gum disease. Is there any truth to that at all?
Yes, Helmut. It should be the other way around, if you have to put it, because of the bad immune system in HIV, and because of the immune system goes down also in leukemia, and because in other normal conditions like in pregnancy and all that, the gum tissue is more prone to catching up this disease. And the disease, once it enters inside, and because of the bad immune system, it travels faster in the bloodstream. Even in the bad heart valves, when the patients have mitral valve prolapse and all that, we have to be very careful when we are actually cleaning around the gums, because the same principle applies. And if an artery is slightly injured while we are cleaning the gums, the plaque which travels inside can even create a very severe infection like a septicemia. It can go into the heart, endocarditis. It can go and travel and block right into the brain cell somewhere and create a stroke. It can create many other things. And the immune system of the person is...
Well, obviously it is well known that the gum is kind of the gateway to the blood vessels. I mean, if you put salt or whatever it is under the tongue, it goes right away into your bloodstream. So at the same token, I suppose if you have an infection in your gum, it goes right into the blood and goes all over to the kidney, to the liver, to the heart, as you said, to the brain, and that can't be good, can it?
No, it is very, very likely it can travel. And it also depends, as you said, into the immune system of the patient itself. If the patient's immune system is not strong enough to bring the defensive cells in the area and clean this infection out quickly, the infection can travel through the bloodstream. So
it looks to me that the gum disease is more dangerous in terms of overall illness in the body than losing the tooth, because losing the tooth is expensive because you need to put an implant in, but at least it can be fixed. But while it is not fixed, it ruins your body.
Yes, I wish this knowledge was there with all our medical colleagues and all the profession in the medical field, because they are many times not aware of how severe this gum disease can be to the patient. Even when we have to discuss at times with the nurses and physicians, we have to actually, many of them are aware, but some of them are not aware on how severely a patient can be affected. Even during pregnancy and normal condition like that, we try not to clean at times because it can travel, like you said, right into the bloodstream.
Yep. Well, thanks for clarifying that, Dr. Patel, and I hope that it helped the patients out there listening to it, and more importantly, I hope that they will start act on it, because tooth loss is one thing, but thanks God, dentists can fix that pretty good. But once your liver, your kidney, your heart, your brain, and the other immune system is affected, there's not much one can do about it, and it's kind of like a really slow death. So thanks, Dr. Patel.
Thank you, Alma. Thank you very much.